Welcome to Be Wise, information about cannabis for older adults. Brought to you by Active Aging Canada, a national charity that supports older adults living well and remaining active. Production for this podcast was made possible through a financial contribution from Health Canada's Substance Use and Addictions Program. Now, let's go to the Active Aging Canada studios and join National Executive Director Patty Clark and Ward Maxwell, Director of Marketing and Communications. Today, cannabis and medical conditions.
Well, welcome back. Today we want to talk about cannabis and medical conditions. Cannabis is said to have many health benefits, but as we've said over and over again, there is little scientific evidence to support many of the therapeutic claims. We do have anecdotal information, and anecdotal information is what people tell us. But because it's simply what people tell us, we can't say that it's scientific evidence, but we are going to share some of that anecdotal information with you. So there's no question that more research is needed to understand the benefits and risks. And there's no question that more and more research is happening every day now that it is legalized in Canada. So there will be more information that comes out every year about the benefits of the cannabis product. So Health Canada does allow the use of cannabis for any medical condition as long as the doctor prescribes it. However, cannabis has not gone through the regulatory process required to be approved as a drug. So there's a difference in that. There are a few synthetic cannabinoid products that have been approved for clinical use for specific conditions. And these names are called Sesamet and Sativex.
Nonetheless, there are benefits of cannabis that older adults do report. And what we know from those anecdotes is that cannabis products can work for some people and not for others. But there are those who do claim it works for them. So when we look at what older adults are using medical cannabis for, what they are trying to treat, what benefits they are looking for, they say using cannabis gives them a better quality of life, it helps with sleep, it helps with pain, and we find very importantly for the older adults that we've spoken to, it allows them to stop using prescription drugs. Now, the effectiveness of medical cannabis appears to be very individual. It depends on the reason for its use and finding the right type and dosage. So we're always going back to this statement. You have to participate in your treatment using cannabis because you're the one who understands how it's affecting you better than anyone else.
Right, Ward. We've also have found in our literature reviews, the research does show that there are 3 conditions that do benefit from medical cannabis: chronic severe pain and palliative care, nausea and vomiting caused by chemotherapy, and muscle spasms due to multiple sclerosis or spinal cord injuries.
Nonetheless, older adults' interest in cannabis as therapy is increasing, and as a result, the medical community is taking a practical approach. The conditions that are currently being treated with medical cannabis include certain kinds of pain, arthritis. Cannabis products are used in palliative care, both to help with pain and also with end-of-life issues. Cannabis products are being used to treat sleep and insomnia. People believe that cannabis can help with a lack of appetite. Cannabis has been considered for use in treating glaucoma. Cannabis has been used in treating dementia, and there seems to be some success with CBD, with treating anxiety and depression. That's all we're going to talk about today because we're going to want to focus on very specific aspects in our next podcast, and we're going to expand on the information about these various topics we've touched on and what the research says. So until then, thanks, Patty.
Thanks, Ward. Talk to you next week again.
Well, that's all the time we have for today. For more information, go to activeagingcanada.ca, where you can order a copy of our Be Wise booklet. It's available in 17 languages and is free. The views expressed in this podcast do not necessarily represent the views of Health Canada's Substance Use and Addictions Program. Join us for our next podcast, and until then, remember to be active, be healthy, and be wise.